Okay, so let's talk a little bit about classification and diagnosis. The most widely used classification system is the DSM, but there is some concern that the DSM has not given sufficient attention to younger children. There are a lot of other concerns with the DSM, but I will discuss briefly what the role of the DSM is. So the DSM is a categorical approach to classification, meaning that either the person has the disorder and meets the criteria for diagnosis or the person doesn't. So the difference between what we consider normal and what we consider pathological is really a matter of kind rather than a matter of degree. And this is different from what we call, dimensional classification, which is this idea that all children have all of these things to a certain degree. So instead of saying John has major depressive disorder, it might be more accurate to say something like John scores above average on the dimension of depression, whereas Julie scores below average on the dimension of depression. So the dimensional approach does not classify people into categories, but rather places them on a scale. The DSM in general has changed some. We're now using the DSM-5, and there have been some changes from the previous edition, the DSM-4. Some notable changes, things you'll read about as you progress in this course, is that we no longer diagnose Asperger's syndrome. Now everything is classified as autism-related disorders. We have also we no longer have subtype classifications for different forms of schizophrenia. And finally, we have renamed gender identity disorder to gender dysphoria. So these are just some of the notable changes. In terms of diagnosis, why do we do it? Is it important? There are obviously some advantages to being able to diagnose. One obvious advantage is communication. So let's say I decide as a clinician that my patient may need a psych referral, may need possible medication. Then in order to communicate what my concerns are, I probably need to put a name to what it is that I'm seeing and what it is I'm dealing with. Another advantage for classification and diagnosis is for billing and insurance. So insurance companies, if they're going to reimburse a client or a facility for services, they need to know exactly what it is that they're paying for. And if there are any questions, they will either deny care or delay care. So the classification system actually speeds up the process. A third advantage for diagnosis is that it can aid in prevention and in treatment. So if you know your client has autism, you can use existing research to determine her prognosis. For example, most children with autism show chronic impairment in social and communicative functioning. However, prognosis is higher among children with higher intelligence and more developed language skills. And so we would use this information to plan an intervention. And then finally, diagnosis can help parents. Okay, no parent is happy that their kid has a diagnosis, but many parents actually feel relieved once the disorder's been identified. Okay, now there's a name to what's been happening. So it's all intended for good, but sometimes diagnosis carries with it certain things that might not seem so advantageous. First and foremost is stigmatization. So when we talk about something being stigmatizing, we're talking about the stereotyping, the prejudice, the discrimination, the self-degradation that can sometimes follow diagnosis, being part of a socially devalued group. So even studies with teachers have shown that teachers' expectations are linked to what they expect for a student. So if they think that a child, or if they know a child's been diagnosed with ADHD, this can set up some pre-existing idea of how that child's going to perform and behave. And then another disadvantage is that psychiatric diagnoses have been expanded to include normal childhood behaviors. Because let's face it, a lot of our adult standards are being imposed on children today. And it's important to know that there is really a world of difference between what is normal behavior in a child and what is normal behavior in an adult. Temper tantrums, swift changes in mood are not considered normal in adults, but they are business as usual for children.